Hi, I come your way again. This time around, I want to test your understanding on the development of the kidney so far. So, I have 10 questions for you. I want you to enjoy it. So, number one will be, which component of the intraembryonic mesoderm is the mesonephros derived? Which component of the intraembryonic mesoderm is the mesonephros derived? Which component of the intraembryonic mesoderm is the mesonephros derived? This question demands that you should understand what intraembryonic mesoderm is, and I mentioned that as a prelude to one of the videos regarding the development of the kidney. I expect that you will remember that, or else go back to the video. But I may be lenient to just give you a clue. There are three main germ layers. One of them is the intraembryonic ectoderm, which we usually call ectoderm. Then you have the intraembryonic mesoderm, which is also called mesoderm. Then you have the intraembryonic endoderm, which we call endoderm in simple terms. Remember, this is the technical names we give to this trilaminar disc. Usually, we assume that everybody knows that it's already intra-embryonic, because there's also extra-embryonic mesoderm. Okay, extra-embryonic mesoderm. That is the mesoderm that split into two to form the somatopleuric or extraembryonic somatic mesoderm, and then splanchnopleuric or extraembryonic visceral mesoderm. So please note that. Number two, the Wolffian duct is not derived from the intermediate mesoderm. Is it true or false? So note also that the Wolffian is an eponym. Wolffian duct is an eponym which is named after the scientist who discovered it. It's called Friedrich Wolff. Friedrich Wolff. So that is an information for you. Number three, list the three kidney systems from caudal to cranial sequence. The three kidney systems from the caudal to cranial sequence. It can also be turned upside down, and the question could be, list the three kidney systems from the cranial to caudal, which is the normal sequence you know. So this time around, it's rather from the caudal to the cranial. So those of you students who don't read the questions well to understand, and then because you know the answers by heart, you want to pour them down and go your way. This simple question, you may end up listing the thing rather from cranial to caudal without looking at it, and you get it wrong. Number four, the mesonephros forms from the nephrogenic cord. Is it true or false? And again, which of the three kidney systems forms the definitive kidney? You should be able to give the answer with your eyes closed. The fetus swallows several milliliters of amniotic fluid mixed with urine every day, which is later absorbed by the intestines. What is likely to hinder this process completely, and what is the term used to describe such anomaly? Okay, you are supposed to swallow something and is unable to enter the intestines. What do you think would be the problem? In this case, your understanding of the congenital anomalies of the GIT, especially the esophagus point or region, should be a clue. And you remember, I covered this in a video on the GIT when I explained how the esophagus is formed from the foregut by the division of the lumen of the foregut by the tracheoesophageal septum and the anomalies that can accompany those divisions, one of them being esophageal atresia, and we also looked at esophageal stenosis when there's no proper recanalization due to the epithelial plug within the lumen. So you need to relate this. Then again, there is another thing that can happen in relation to this. I don't want to give the answer in my statement. So, uh, number 7, an outgrowth from the mesonephric duct forms what? An outgrowth from the mesonephric duct. What does it form? An outgrowth from the mesonephric duct. What does it form? And also, let me point at this that the nephric duct or the Wolffian duct is sometimes called mesonephric duct. Okay, we sometimes call the whole stretch mesonephric duct. So it can be used interchangeably, but strictly speaking, if you want to mention that all that cord or tube, it's actually a nephric duct or Wolffian duct. But sometimes we call everything mesonephric duct. At which time does the kidney attain its adult position? At which time does the kidney attain its adult position? In terms of weeks. The ureteric bud gives rise to which of the following? The ureteric bud gives rise to which of the following? Is it ureter? Is it renal pelvis? Is it minor calyx? Or is it all of these? At what time does the pronephros disappear entirely? The pronephros, we know it comes and goes. The first that appears and disappears. So the question is, at what time in weeks does the pronephros disappear entirely? Yeah, so this is what I'm serving you with this time. Enjoy it. Much.